So today I'm going to explain about this 7 series. So in that 7 series, it will come for the radiology. So in that first topic, I'm going to explain about X-ray. So any X-ray code
Hello.
want to search in that 7 series, 6 questions it will come.
இந்த விஷயம் வர மாட்டேங்கிறான் கேட்ட பார்க்க
म्यूट வச்சுக்கடா அன்மியூட்
Hello,
Yes, yes.
sir. I'm in the class.
What?
Okay, sir. Done.
So 7 series, it is the radiology. From this in your exam, 6 questions. First topic X-ray. So you want to take the X-ray codes. You need to go with your book backside of the CPT. You need to go X-ray under what location? It's a elbow, knee, chest, abdomen, like that. Okay, you need to go with your backside of the CPT and you need to search. And views, AP view, PA view, lateral view, oblique view. So PA, posterior anterior. Posterior anterior. Posterior means back, anterior means front. So back to front. That X-ray beam enters back of the body and exit front. That is for PA. AP, antero posterior. Antero posterior. AP. So X-ray beam enters front of the body and exit backside. X-ray beam enters front, anterior means front, exit back. That is the antero posterior. Then oblique. Oblique means is the angle view, cross view. Example, X-ray beam enters left shoulder and exit right hip. So left shoulder to right hip. That is for oblique. Then lateral. X-ray beam enters one side and exit another side. Lateral means side view, left to right or right to left. That is the lateral. So you need to check for the location and views. Suppose if I'm telling AP, PA view. AP, PA view means what is the answer? AP, PA view. AP, PA view means how many views? Yes, two views. AP is the one, PA is the one. So two views. Okay, so you need to check for the location and views. AP and PA is the two view. And modifiers. Here in this we'll use modifiers RT right side, LT left side, 50 bilateral, 52 reduced service. So RT means right side, LT means left side, 50 means bilateral, 52 is the reduced service. So bilateral means both side. One procedure done both side, right and left. That is a bilateral. Then 52 is there reduced. While checking inside the book, that CPT having 5 line items. But in that Doctor done only 2 lines. MD is thinking only this much is enough. No need to do more than that. So he did only half of the procedure. He did only half of the procedure. It is for reduced service. Not done full. Only half of the procedure done. It is for reduced. Okay. So this one you have to know. While checking inside the book, the procedure is not done fully. Only half of the procedure done. It is for reduced T2 modifier. Then 26 professional TC technical component. So professional is interpretation report of the radiological service. Interpretation and report of the radiological service considered professional component. Okay, technical means cost of the equipment like resources like room, electricity, salary of the technician. This all comes under technical. Provider given interpretation results of the radiological study. You will tell some interpretation results, right? That is for the professional. But that X-ray taken by using the equipment, that equipment cost, who's assisting to you, the technician cost, that room, that X-ray machine where they are keeping, that charges all comes under technical component. Technical. So you need to know what is meant by 26, what is meant by T. So interpretation given is there 26. Cost of the equipment, resource, supplies, room, electricity, salary of the technician. Consider technical component.
Professional component.
You are going by one nearby one clinic. Okay, you are going nearest one clinic. That clinic not having the X-ray equipment. In that time, what you will do? You will refer the for chest pain related condition you visited in that clinic, that X-ray equipment not present. In that time, he is referring the nearby one diagnostic center. You are going there and taking their assistance technician helped to you to take the X-ray of the chest. After that, the technicians in the diagnostic center they are giving one report and all report that X-ray film and all they are giving. You are collecting that and coming back, you are showing to the provider. Now provider is looking the film independently, individually. That provider is looked at the film. What he is seeing in the film, he is writing the results, he is writing the summarization. I personally independently interpreted the X-ray film. It was some mass present in the chest or nothing is there. Everything fine. This is for the professional component. This is for professional component. You are like this interpretations given, results given, provider given mean for them you need to add means you need to give 26 professional service. Provider given interpretation. Okay, but you went nearby one dance center. There you need to pay money for the equipment cost, technician cost, the room electricity and all. It is considered technical. Okay, so you need to know there clearly when need to use. If interpretation given, it is the 26. We are billing for the equipment, electricity, radiology, technician who having the equipment for that person that for them we are paying mean it is TC. Suppose one provider visiting clinic, that provider having their own equipment, that provider having their own equipment, own equipment. Okay, you are visiting that chest X-ray ordered taken by using the own equipment. After that, he is telling the results of that, interpreting. Is giving the results of the interpretation of the X-ray also. So that provider is doing both service. He is giving the interpretation and also taken by own equipment. So one provider done both service, technical and professional. In that time, what you will do? Any idea before? One provider is doing both service, technical and professional. Please remember, don't use any modifier. You are not giving any modifier, mean you will get full amount of the technical service, professional service. But you are adding only 26, mean you are telling the doctor only done the professional service. You are adding TC, mean you are telling only technical. We use only equipment, like that. You are not adding any modifier, then you will get full amount. That means technical service amount, professional service amount. So provider done both service, no modifier. Provider done both service, no modifier. Okay, everyone clear this? Provider done both service, no modifier. Suppose one provider is working in that one hospital. Okay, one familiar hospital working, you are visiting there, chest pain ordered by the MD, but taken by the using the hospital equipment. After that, that MD is receiving the report X-ray film and all. Now provider looking the X-ray film, what he is seeing in that is writing the summarization. So my question is, how will you report the provider service? Provider given what? What he given in that hospital? So my question is, you are visiting that provider working in one hospital. There you are visiting for chest pain, taken by using the hospital equipment. The provider is receiving the report of the X-ray film, everything. Now my question is, how will you report the provider given interpretation of the report X-ray? My question is, how will you report the providers?
Without modifier.
But equipment, whose equipment? That provider equipment.
One equipment, right?
He is working in one hospital. Then how it will come own equipment? Hospital equipment, that facility equipment, right?
Hospital equipment.
Yeah, then how will you give think correctly? So provider given only interpretation. He is not owner of the equipment, correct? So provider given only interpretation. So only interpretation means you need You need to add 26 one. Provider given interpretations is not owner equipment. Then 26.
இதெல்லாம் முதல்ல ஆஃப் பண்ணுங்க ஃப்ளோல போயிட்டு அப்புறம் அது ஆஃப்ல தான் இருக்கு
என்னது புற பாட்டு
Okay. So everyone understood?
Sir, having doubt. Yes, sir. Why we can't use like we don't use 26 and TC modifier at the same time because hospital equipment also they use, right?
Like if they are asking question, how will you report the hospital? Then hospital charge separate. TC it will come. In
Okay.
provider record, why you are giving that TC? I'm telling. That is for only provider service. You are billing for only physician what done.
Okay.
Okay.
Suppose
So
they
you are coming to the
they ask,
facility billing. You are coming to the facility billing. In that time, the same code with TC modifier you will give.
okay. Okay, okay, sir.
Question is the provider service or technical? That is the difference. You are coding for facility, you are coding for provider. Physician billing or facility billing. Okay. So that one you need to know. And you want to take the X-ray codes, you need to go with your book backside of the X-ray under X-ray under elbow, 1 view, 2 view, 5 view or ankle you have to take. Okay. So I'm giving for the modifier related questions first. Then I will go for that direct X-ray questions. So you can give the modifiers. These 3 question, what modifier you will use? Please check and tell these 3 question, what modifier? First one, what modifier? Second one, what code, what modifier?
Option D.
Please give the 3 question answers with modifier. Okay, I will tell answer. First one is for the Christian office, they can be using their own equipment, MD interpreted. So technical and professional. So both there is done no modifier. So your answer 71045. Second one 71045. It is hospital using the hospital equipment. Question is how will you report the hospital? So hospital equipment used to hospital. So here it is for TC. Then last one 71045. It is for the provider service. How will you report the provider? So here you need to give 26. So first one 71045, second one 71045 TC, third one 71045 26. Everyone clear? Guys, clear, right? So X-ray of elbow 2 views, X-ray of elbow 1 view, X-ray of elbow 5 views, X-ray of ankle laterals and transverse view. Okay, please take that another 4 question. You can go with your alphabetical index, check with the inside the tabular and give correct answers. Okay. So I'm going to give the answer. Second. Okay, please cross check. Please cross check everyone.
We're having doubt in fourth one. Hello. Hello, can you hear me, sir?
Yes, yes. Tell me. Everyone clear? Two views 73070. But in X-ray of elbow, while checking, two views code only starting we are. Two views code only we are starting. One view they're telling me we don't have the one view. So in that time we are giving the two views code. In that we are adding modifier 52. We are telling two views only we have. In that one view reduced. So reduced we are telling. So 52 modifier. Okay. Then X-ray of elbow 5 views. 5 views mean in that 73080 is the complete view. Is the in the elbow that is the complete view. If that more than that doing also same code only. 3 views they complete. More than that doing also same code only. 73080. Last one X-ray of ankle laterals. Laterals mean right and left. Plural word correct. Lateral na single. Laterals na plural. Both side. Laterals. So 2 and transverse 1. Total 3 views. So that 73610. You clear now? Okay. Next. I'm going for CT, MRI, MRA. CT, MRI, MRA. Full form you need to know. CT mean computed tomography. Then MRI, magnetic resonance imaging. MRA, magnetic resonance angiography. Angio mean blood vessels. Angio mean blood vessels. We have arteries, vein, capillaries. Arteries, vein, capillaries. So three type of blood vessels we have. Artery, vein, capillaries. Then you need to check the location. If you want to take the CT scan under what location? MRI under what location? MRA below you have to look the what location. That is the first point, location. Then how the procedure was performed, like with the contrast, without contrast, without followed by with contrast. That contrast material using now is with, not using now without. Initially not used, later using in same encounter, without followed by with contrast. What is will be contrast? Contrast material now it is a dye or chemical. Dye or chemical which is used to get the clear picture of the internal parts. It is used to get the clear picture of the internal parts. That is the contrast. So contrast is the dye or chemical which is used to get clear picture of the internal parts or body area. That is for contrast material. That contrast material, how they are administering to the person? They are giving through oral rectal. Contrast material given through oral and rectal. Oral or rectal via given, it is considered without contrast. So contrast is the dye or chemical. It is used to get the clear picture of the internal parts. If not using contrast, you will not get clear picture. You will get dark pictures of the inside. So that contrast material using now, you will get clear picture. So that is the contrast. So that material using now with, not using now without. Initially on 9 o'clock not used, but 10 o'clock using now, it is without followed by with contrast. Okay. So you need to know that. Then that contrast material given through oral and rectal. Oral and rectal. Contrast material given through the oral, rectal, it is considered without contrast. Oral, rectal is without contrast. The contrast material given through intravascularly, intraarticularly, intrathecally. Intravascular, intraarticular, intrathecal. This is for with contrast. Oral rectal given, contrast material given, but the root is oral rectal, it is for without. The contrast material given through intravascularly, arteries and vein, intraarticularly, joints, intrathecally, spine. In these roots given, it is considered with contrast. Contrast material, what root giving? Oral rectal is without, intravascularly, intraarticularly, intrathecally is with contrast. Okay, so this one you need to know clearly. Please read the notes, everyone, once. And you can take the starting of the 7 series. What page number starting 7 series codes? You are taking the starting of the 7 series, radiology guidance, radiology guidelines in page number 521, 521, 521. If you are looking down, given administration of contrast material, administration of contrast material given. Okay, the in that first paragraph, intravascularly, intraarticularly, intrathecally, it is for with contrast. In down last paragraph, oral rectal administration alone does not qualify as study with the contrast. That means without contrast. Okay, you forget also, you can look these pages and take the answer. Theoretical question you can answer. What do you need to repeat? What do you need to repeat? I'm telling contrast material 521 page number. That contrast material given through intravascularly, intraarticularly, intrathecally mean it is for with the contrast. In that fourth last paragraph, you are reading oral rectal, it is without contrast. So only I said contrast material given mean with not given without, but the root is also very important. Oral rectal contrast material given means what you will tell? Contrast material given through oral rectal.
Without contrast.
Yes, you need to consider without. Intravascularly, intraarticularly, intrathecally, it is with. Okay, so like this only you need to know. Okay, so I'm going to give questions for CT, MRI related. You need to go with your backside of the CPT book, CT scan or MRI. Like that, you can try the question. Please remember, root is what? Okay, take the answer for this. Guys, I'm going to give. So CT scan under, you can look the location. For breast procedure, breast under MRI, you can search, you will get. Breast under MRI, you can search, you will get. Okay. Now I will give the answer. You can cross check. You have doubt anything, you can ask me. So please cross check. First one 70470. The without followed by with. Then second one oral contrast mentioned. Oral is the not considered. So without contrast. Then CT of brain without followed by with contrast 70470. MRI of brain 70553. MRI of breast 77048. Okay. So any doubt in this?
சார் அந்த வித்தவுட் ஃபாலோடு பை வித் கான்ட்ராஸ்ட் ஃபாலோடு அது மட்டும் ஒரு வாட்டி எக்ஸ்பிளைன் பண்ணுங்க.
They're clearly mentioned no? Without the 9 o'clock they're taking CT. That time not used any contrast. Maybe while taking 9 o'clock they got not clear picture. They will get dark pictures only, right? So that again maybe 11 o'clock or 12 o'clock again same CT of the brain using doing. By this time they are using contrast material. So one encounter they are telling contrast without and with they are telling. Now you can go with the without followed by with the contrast. Okay. They will mention without and with they will mention. Don't worry, they will clearly mention. Question. Everyone clear? Any other doubts? So this one breast under MRI you are searching will get. Is any other doubts? Anyone? Then bone and joint studies. Bone and joint studies. So they are using the DEXA, dual energy X-ray absorptiometry. DEXA, dual energy X-ray absorptiometry used to check the bone and joint abnormalities, bone age, bone density. That is for DEXA. So dual energy X-ray absorptiometry used to determine the bone and joint abnormalities, bone age, bone density. Okay, so that is the DEXA. Here I given bone and joint studies code ranges 77071 to 77086. So DEXA code you want to take, you can go with that code ranges in between below. Every code you can check. All codes you can check. and you can answer my questions. I given below 4 questions. With the direct one, no other guidelines. But you need to know below above how to read. The descriptions how to read. You're knowing well to read CPT description, you will take the answers. Okay. So please find this one. Below I given code ranges. Please go there code ranges. That all CPTs you can look one by one down above anything given. Based on that you can answer that these 4 questions. Okay. So you are going taking the code ranges in between, below, above. You are reading. You will get the code. Okay. Please again. You have 1 minute. Please take. You were not given. Please give quickly. So what page number this codes and all present? Five five three. Yes. Page number 553. You're going starting of the Boron Joint Studies code here. 553, 554. Okay. So you are looking the page number 554 in the code 77081. 77081 CPT. You are looking down for dual energy X-ray absorptiometry DXA body composition study. Use 4676499. We are stating use 76499 for dual energy X-ray absorptiometry. Need to use the code 76499. Okay, so this one you need to know. First one. Second one, so bone density study 77080. Second one is 77080. Third one for DEXA for the spinal fracture assessment. So spinal vertebral both same. You are looking the code 77086 DEXA spinal I said. So DEXA vertebral fracture assessment. DEXA vertebral fracture assessment or spinal fracture assessment. Your code is 77086. 77086 is the third one. 77086 is the third one. Anyone having doubts? Because this alone one paternal code, right? It is not subcode. So direct description. So vertebral fracture assessment, spinal fracture assessment via DXA. So your answer 77086. Third one. Fourth one is DEXA for the bone density study and vertebral fracture assessment. So 77085 we are reading the subcode. So you want the paternal lines. So dual energy X-ray absorptiometry, bone density study, one or more sites up to semicolon. Dual energy X-ray absorptiometry, bone density study, one or more sites. Then including vertebral fracture assessment. 77085. Dual energy X-ray absorptiometry, bone density study, one or more sites, axial skeleton, including vertebral fracture assessment. 77085. That is the correct. So I'm giving answers once again. Please cross check. You have doubt, you can ask me. So DEXA for body composition study. So 76499. Then second one 77080. Third one 77086. Fourth one 77085. So anyone having doubt in this? Okay. Last two 77086 and 85. That is very important. From this one question compulsory it will come in the exam. Okay. So you need to know this. Next, I'm going for breast mammography. The specialized X-ray used to visualize the breast. That is the breast mammogram. While coming to the breast mammogram, we have screening mammogram and diagnostic mammogram. Screening mean patient no symptoms, patient not having any symptom. Maybe patient family member, someone having breast cancer or something, so that that person check her breast status. That is the screening. No symptoms, simply they are coming and checking. It is screening. But symptoms, patient feeling some symptoms, maybe pain or cyst or lump in the breast, something she feeling, so that she's coming, check the breast, is the diagnostic. Symptoms present, then doing, it is diagnostic. No symptoms, it is screening. So diagnostic mammogram, we have the code 77065, unilateral, bilateral code is 77066. Screening code only 77067 alone. That code itself bilateral. Screening considered bilateral only default. See, so mammogram it is screening or diagnostic. Diagnostic mean unilateral or bilateral. Like that you have to check.
Hello,
Okay. Yes, yes.
sir. Previously, we have seen that diagnostic procedure, any diagnostic procedure, no symptoms are present. But here in mammogram, diagnostic mammogram, symptoms are present
No, no.
because
They will.
diagnostic colonoscopy we have already seen na? In
Yeah,
diagnostic
yeah.
colonoscopy. Huh.
No, no. That time also, why they are coming for colonoscopy? Maybe they felt something in the colon.
Okay, okay.
Correct.
Symptoms present, diagnosis is not yet
Ah.
detected. Yes, yes. Now clear. Now clear. Thank you, sir.
Okay. So diagnostic we have unilateral, bilateral 7706566. Screening 77067. Okay, so please read the notes and I given one question. Please find the answer for that. Okay, so is the symptoms present? So that time we are doing is the diagnostic. Left side means single. So unilateral 77065. 77065 is the answer. Okay. Then we have for the next one myocardial perfusion imaging study. So next topic, small topic, myocardial perfusion imaging study. We have the code 78451 52 53 54. 78451 52 53 54. Myo means muscle. Cardial means heart. Perfusion means flow. Myo means muscle. Cardial means heart. Perfusion means flow. So myocardial perfusion imaging study. They're checking the blood pressure and blood flow in the heart muscle. That is the myocardial. So while coming, we have four codes, right? In that first two codes, in your question, they're telling the word SPECT, tomography, attenuation correction. SPECT, tomographic, attenuation correction. These three words present. SPECT, tomography, attenuation correction. These words present, you need to consider for 78451 and 52. 78451 and 52 based on the single or multiple study. Using SPECT, tomography, attenuation correction, that words present, then it is for 78451 and 52 based on single and multiple. 78453 and 54. 78453 and 54, it is for myocardial perfusion imaging study. If you don't have the word SPECT, tomography, attenuation correction, not having, default is planner. The planner code only 78453 and 54. The planner code only 78453 and 54. Okay, so please go and check the codes 78451, 52, 53, 54. Everyone, go and check inside the book what page number these codes and all present. Okay, okay. Please go and check the page number 565. So tomography, attenuation correction, spect word present 7845152. If not having, planner is the default. Okay. Then next one, I'm giving direct question. You can try from the alphabetical index. Blood pool imaging under cardiac. You can try the answer for this. Blood pool imaging under cardiac. Please try. Guys, anyone tell how to search? I said you have to go with your book, cardiac blood pool or blood pool imaging under cardiac. You not getting? It is there, no? Blood pool imaging, it is
Yes.
there.
Yeah. If blood flow imaging is directly.
Blood pool imaging under cardiac. First pass, gated, yeah. Page number 1067, 1067. Sometime here also questions coming, so that only I given this questions. Okay. So I'm giving the answer. You can cross check. Let's cross check.
First question answer 7
ஆல்பபெட்டிக் இண்டெக்ஸ்ல ஃபைண்ட் பண்ண முடியல சார்.
See, now only I said page number also. 1067 page. 1067 page. You are looking mean it is saying blood pool imaging under cardiac. Blood pool imaging under cardiac. You got 7848128 Your code range, right? You can go and confirm. Gated equal pay means what? First pass means what? Okay. So this is the answer 78481837273. Okay. So today this much only. We are continuation tomorrow. Okay. Okay guys. Thank you all for attending today.